everyone. Today I am going to talk about the most important topic is breast cancer awareness. All we know, as per World Health Organization, it is a breast cancer. It is one of the most common cancer among the women, affecting around the globe. It is almost 2 million individuals yearly. So as per the statistics, 1 in 8 women will eventually diagnosed to have a breast cancer. So cancer is a social illness. It's not only affecting an individual alone, it almost affecting the entire families. Especially in the breast cancer, it affecting a much larger people. So this October month we call it as a breast cancer awareness month. So it is started in 1985. The entire October month from day 1 to day 31 all over the world. It is an annual campaign. It's a time to encourage the woman to be checked, be screened and make their healthy choices and take care of their breast health. It is an annual campaign not only supported by WHO, it is almost supported by our Indian government and various NGOs and private sectors. So currently, even though various research is going on breast cancer, we don't have exact reason or causes for the breast cancer. So the topic why we are discussing about the breast awareness, the proper yearly detection of the breast cancer, it is a key to control the breast cancer. So in our people, especially in the Indian, we have seen almost patient with the advanced breast cancer. So the majority of the death is occurring due to the breast cancer, especially in low and middle income countries like our Indian people. The most women with breast cancer are diagnosed at the late stage due to mainly lack of awareness, especially on the earlier detection and the various barriers to the approaching to the health sectors. There are 3 things I need to emphasize on this breast cancer awareness month. One is mammogram, another is a self breast examination, another is a clinical breast examination. First thing, mammogram. Mammogram is the most common way we can able to detect a breast cancer at an earlier stage. It is nothing but a X-ray of the breast. So as per various cancer societies all over the world, the woman at the age of 40, they are recommending to go ahead for a mammogram at least yearly once till they are in a good health. So many women is getting afraid or embraced about the mammogram. Yes, the mammogram might be uncomfortable. Don't panic on that. It just lasts for a few seconds, not like other imaging for 20 minutes or 15 minutes. The way it is mammogram, it really helps to detect a very early lesion which is not picked by your hands or not seen by your eyes. So if they detected early lesion as per the modern techniques of the treatment, those women, we can, by giving a curative treatment, they can lead a good life as like a normal woman with good life expectancy. Another common thing I want to go and discuss about this is breast self examination. It is nothing but a breast examination ideally done by their own in front of the mirror. It is we encouraging them to go ahead, especially this breast self examination few days after their menstrual period. So detail about the breast self examination, how to do, I will explain in another separate session. So during the self breast examination, don't be panic. The first thing I want to emphasize on that, don't be panic. Many things other than the cancer, it might be there. So if you notify any of the lesion in your breast, such as any change in your size of your breast, contour or skin, you just notifying any skin thickening, dimpling or sometimes puckering, sometimes look like scaly lesions or any lump which you are notifying inside the breast or in your underarms. or sometimes you might notifying the any discharge from the nipple, abnormal discharge. Sometimes it might be watery, sometimes it might be bloody discharges. If any of these symptoms, if you are notifying during your examination, we encourage them to do at least monthly once at the age of 20 years itself. So if you notifying any of these symptoms, please report to the doctor to go ahead for a further test. So next is commonly we are going to discuss about the clinical breast examination. That means the breast examination done by the healthcare professional. Why we are encouraging this? We have seen many women at an earlier age, not like a 40 or 50 years. We have seen quite number of the breast cancer occurrence at the younger age group, especially 25, 30 years. So this clinical breast examination, we need to start at the age of 25 years. At least second yearly or 3 yearly once we need to go ahead the breast examination by a healthcare professional. So that those who doctors who are examining, if they are notifying any of these changes, they ask them to go ahead for some form of imaging like ultrasound of the breast, or sometimes doctors may suggest MRI of the breast if they are having a family history of breast cancer like that. So why I am talking about this breast cancer awareness is more important. So in Western countries there are various organized screening program, organized mammogram. They can able to identify at the early stage. Whereas, especially in our Indian people, Indian countries, we don't have that much of organized screening program itself. It's difficult to implement due to various reasons, logistical issues. So at present, so raising a breast cancer awareness, it is the best way of controlling a breast cancer as a prevention. So join this breast cancer awareness campaign to raise the awareness about their breast cancer risk, identification of the earliest signs and symptoms of the breast cancer, and seek any medical attention, especially if they are notifying something long. And another thing, last to conclude that examine your own breast properly and get the doctors to check out to and schedule your mammogram. These three things, monthly self breast examination, occasional doctor's checkup, and a scheduled mammogram, these are the three best way to catch up breast cancer at an earlier stage. So what finally I want to empathize is trust your judgment when it comes to your body. First, don't think overreactive if you found something abnormal. If you found anything abnormal in your breast, better please check it out. The worst thing what you are feeling might be something suspicious. It's going to be a best thing when you properly check and turns to be a nothing. Okay, so let us fight against this breast cancer by raising a proper breast cancer awareness to reach all the women. So that is the main campaign for this October entire month. So let us fight against this breast cancer. Thank you.